Hello and welcome. Breaking news coming in at the top of this hour. Maharashtra Deputy Chief Minister has said that if cases continue to rise in Maharashtra, masks may become mandatory once again. However, currently, despite the uptick in cases, there is a low requirement for oxygen beds and ventilators. There's a slight increase in the positive COVID cases, but there is still low requirement for ventilator and oxygen beds. That's what the minister has said. However, saying that the mask rule, the mandatory mask rule may be brought back if there is a rise in the number of cases. Now in Maharashtra, a significant surge in new COVID cases is emerging as a cause of concern. The state recorded over 1,000 new COVID cases yesterday, with Mumbai alone reporting over 700 new COVID cases. Mumbai Civic Body Chief has directed all civic departments to raise their guard by preparing jumbo hospitals, war rooms and ramping up testing. With the detection of 739 new COVID cases, Mumbai recorded the highest daily new COVID cases in the last 117 days. Let's talk to the experts now on how concerning the situation is in Mumbai. Joining us right now is Dr. Gautam Bansali, member of the COVID Task Force in Maharashtra, and Dr. Sunila Garg, member of the Lancet Commission COVID India Task Force. Thank you very much for joining us. Dr. Bansali, to you first, should the masks be made mandatory at public places once again?
Yes, Rohit. As we already given advice to the public that when just after the third wave also, that we said ki yes, mask is now not mandatory, but now in view of cases which that increasing. Yesterday we have more than 700 cases in the Mumbai. Already we have ramped up that number of testing. We had a meeting 3 days back only with the all private hospital. I hold one meeting with the all private hospital CEOs, and we told to increase number of testing. So we ramp up the testings, and that's why the number of cases was increased yesterday. I feel it's not wave, it's a spike, it's a surge, and that is going to be there for a few more days. And in view of that only, that the Deputy Chief Minister sir advised to wear mask, which we have already told to everybody, person, whether he's a patient or not. If you are having cold, cough, fever, one should wear mask, especially in the inside area, especially in the area where crowded area, especially in the area people are going to get meetings and all the things. So masking is the one weapon which is really helping to curb on that spread of that this disease. And second is the vaccination. So masking is required, which we are already advised to the public. And but I'm sure we should not be panic at all about the spike or surge of this kind of cases.
Right, we should not panic but take precautions. Dr. Sunila Garg, let me bring you in this discussion. What do you think is driving up this surge?
Rohit, I think this is a very, very important question. We have to see I'll say that we have to see, as Dr. Gautam pointed about yesterday's surge, but I will see that we must look at the weekly positivity rate. That is very important.
Yes.
But nonetheless, we need to be very cautious. If I was to talk about the daily cases per million, if we were to look at Kerala, it has got 21 cases per million,
yes.
Chandigarh 20, and Goa 20, like that. And Maharashtra has got 6 cases. But yesterday we had large number of cases, that is 3,712, along with 5 deaths. So it is important to again look at, deaths per million on a weekly basis. But then, everyday pointers, they really, make us watchful.
Yes.
That means, whenever we open the, everything under, Disaster Management Act, it is very important that people should not forget that this is a novel virus. It is teaching us novel things every day.
Yes.
So, we should not forget about the COVID appropriate behavior. Vaccination rates have gone up to the tune of only about 2 lakhs per day in the country.
Yes.
So that is how we can see that we need to increase our vaccination coverage. Also, now vaccines are freely available. People have to go and take the first and second doses, and also the precautionary doses. That is important. Another thing to be remembered is that children will catch the infection very fast, and they will also spread it. So it is important to teach the children as well, because they may not themselves suffer from severe infections, but they are the ones who can transmit the infection very fast. So it is important to be watchful, be careful, but not to panic. At the same time, it is very important to do genomic sequencing as well.
Right, Dr. Bansali, the BMC chief has asked the civic officials to ramp up COVID testing immediately on a war footing and keep the staff of jumbo field hospitals on alert. Now, testing is one way to detect the cases, but how do we arrest the spread of the virus?
Yeah, to that arrest the spread of this virus, that's why we said that the person who is having cold, cough, fever, they should use mask. They have to use mask. Other than that, if you are going in the crowded area, if you are going to shopping mall, if you are going to movie theater, anywhere in the crowded area, you should wear mask. Mask is the biggest weapon to fight this COVID. We have seen the use of vaccine also in the third wave. Omicron wave was very light in our country because of huge vaccination. Same way, we should motivate children to get vaccinated as soon as possible. Like so many people are still thinking about taking a booster dose. Children are also not getting prepared for the booster dose. That's why we are starting door-to-door vaccination program from today only. In the BMC ward is also prepared. Jumbo hospitals are also prepared for that admissions, and all private hospitals are given instruction to all the private hospitals to increase their bed capacity, or whenever patient is coming, they should prepare for the admission also. Although
Yes.
hardly 10 to 12 patients are admitted in private hospital, and they all are in the completely normal way. They are not require oxygen or medications, nothing. They are in fact the incidental finding.
Yes.
If we see number of cases of dengue or malaria, they are more than COVID. So that's why we are saying we should not be fearful at all, but we should be careful.
Careful, not fearful. Dr. Garg, 231% rise in hospitalizations in the month of May in Mumbai compared to the month of April. There's been double-digit hospitalizations every day for the much of last 1 week. Why is the hospitalization going up?
That is where I'll say that the number of cases which have gone up, is because of lack of COVID appropriate behavior. That's the number one thing. Number two is the people, people who have taken the vaccination. Now, over a period of time, the immunity wanes. That is also another important reason. And then, when you are not following COVID appropriate behavior, you're not vaccinated. The third part is that another important guideline for the offices, for the schools and everywhere is that if you're, having symptoms, you must isolate yourself. When people are not isolating themselves, that is another reason. So for, kind of spread of infections, but we must be watchful about the genomic sequencing. We must not lose a sight of what kind of virus it is there, because we know as of now it was, we have got 4.1 and 5.1 also. That is another important, but these are all variants of Omicron. But then another important thing we have to remember is that as of now, as I said, that we must be watchful of the situation. Situation is not scary, but then we have to also keep a watch on the weekly positivity. That is important.
Yes.
And we must do the watching as per the districts also.
Right. Dr. Bansali, one final question to you. You're talking about masking and all of that. That's one thing, but social distancing norms are pretty challenging to impose in a city like Mumbai, isn't it? Unless, of course, you make certain restrictions mandatory, but we're not looking at going back to the lockdowns yet. But, how do you ensure social distancing in a city like Mumbai?
Yes, definitely. It's a very challenging task to maintain social distancing, especially in the highly densely populated city of Mumbai.
Yes.
Because we don't want to go back to all that kind of curve and restrictions, all that things, because we need economy to boost up also. Yes, we want to save patient, but why lockdown and all these kind of things was required? Because that time everybody was not aware. People was not knowing do's and don'ts. So everybody now aware about the things. People should self-isolate, self-lockdown sort of things should be there. People should monitor themselves. As of now, everybody knows what is oxygen saturation level. All are aware. All are highly educated people in city like Mumbai. So I feel social distancing is required for the person who is having a bad cough, who is
Yes.
having running nose, who is having fever. Same way, like masking is required, and they should isolate themselves because still home, that work from home culture is still existing. So I
Yes.
feel people are enough educated. We just need to boost up them, and we just to request them, if you are having any kind of symptom, whether you are COVID positive or not, you should self-isolate yourself.
Yes, Dr. Garg, one final question to you. How do we boost up the inoculation drive? You know, people have become lackadaisical in taking boosters, and also, you have to boost this vaccination in the 12 to 18 category. So how do we do that? A, and B, you spoke about children who could spread the infection fast. Should we go back to the hybrid schooling? What would you suggest?
No. See, there is no compromise between the vaccination and the development status of the children.
But especially the smaller children, ma'am, for whom the vaccines haven't opened yet.
No, it doesn't matter, Rohit. The children will suffer from infection, but they will they recover very fast. Because when you will see and talk to the doctors, most of the time the development has gone so much behind. We are almost 4 years behind. So, what is important is that what you yourself are showing the scenes on your, screen. I can see how is the, not even one person I can see is wearing mask across. And, so much of, there's no social distancing. And for children, we have to talk to the school authorities, we have to talk to the parents, and we make sure they get the vaccination. That is important. But let me also tell you the another part of it. That,
Yes.
It is important to follow, a COVID appropriate behavior rather than, because another thing what I'm worried about is that despite getting the vaccination, it is no guarantee that children will not suffer from infection, because vaccine will protect you from moderate to severe infections and hospitalization. Okay, so that is where I'm telling you that it is important that children also should be taught, particularly 5 years and above, about COVID appropriate behavior, sanitization and hand washing and all that. And, the schools should have the classes with the social distancing. That is so sensitization of all the stakeholders, right from the education department to the teachers and also the parents, when the child comes back from the school, So, parents also, whenever particularly the elderly is at home, so we have to be cautious about them.
Yes.
So children will not suffer by themselves with severe infections. They will recover very fast. And it is something what we did with, chicken pox party also at one time. We said that come together and get infection, so that this is what not we are aiming at it now, because we have gone through 2 years of pandemic. But children now will learn about, basically the COVID appropriate behavior, because we cannot afford to go back, in terms of development, because India is only among 5 countries in the world where the schools have been closed.
All right, Dr. Sunila Garg and Dr. Gautam Bhansali, thanks very much for joining us and sharing your perspective. So the doctor is saying, take precautions, be cautious, but don't panic.